So how can you help a cognitively impaired person make a new memory, particularly an explicit memory? Well, ask them how well they think they're going to do on a task. So you've been working on an eating behavior. We've been working on cutting up food in small enough pieces so you don't choke on it. How well do you think you're going to do on that? Post-diction, how well did you just do on that? Retention testing that's announced beforehand. This right here is a fabulous new tool that you can put into your tool shed. I use this all the time at the university. I have this one sentence. It's almost magical. This one sentence can turn on a whole lecture hall full of frontal lobes immediately. Do you know what that one sentence is? Yeah, this would make a great exam question. That one sentence will turn on frontal lobes. The whole room shifts. Students will raise their hand, say, "What did you just say? Could you give us another example of that?" And then what I love to hear is if somebody says, "Is this an example of that?" and they give me their own example. Now I know they're making connections. Well, you can use this retention testing announced beforehand as well. Tell patients, hey, there's one thing I want you to remember, and come back to it, and make sure you ask them and have them to remember it. It's a powerful technique. And we even know how often and when you should come back to it. It's called spaced retrieval. This is a fabulous technique in which you present some information and tell them you're going to test them on it, and then do test them, say a minute later, and then double the interval. 2 minutes after that, 4 minutes after that, 8 minutes after that, you test them again with a doubling interval. And then at the end of the session, and then begin the next session testing them on that fact, that compensatory strategy, for example, that you're trying to help them turn into an explicit memory. It's a very useful technique. And beginning with a successful experience on the beginning of your next session will set you off to a good start.
So if you want to try to help a patient move within or move to the next level of awareness, you got to have some strategies for how you're going to do that. And you've got the intellectual level of awareness. So in this situation, basically what you want to do is allow patients to safely experience problems. That's probably the easiest way to put this. You're keeping them in a protected environment. You're not letting them physically fail. You're not letting them cognitively fail. You're giving them every opportunity to receive assistance in a timely manner so they're not getting frustrated or injured. And a level of intellectual level of awareness, you're basically just trying to show with enough repetitions and exposure that this patient gets an opportunity to see that they've got a problem. For a patient to be able to move into the level of emergent awareness, they've got to be aware that the problem is occurring when it's occurring. And so for this, it's always helpful initially when they're making that transition that before you even start a task, perhaps your patient is given an opportunity to rehearse what they have experienced in previous efforts of that task. Well, I remember last time I tried this, I stood up and I forgot to put my left foot into place. So emergent awareness might be more likely to come into play if you've actually rehearsed some of the past efforts with them and asked them to see if they can call up previous efforts so that when they get into a problem, they can recognize it more quickly because they just got through talking about its existence very recently. Now, in your best effort to push a patient toward emergent awareness, you still need to allow problems to occur. And you need to allow greater degrees of loss of balance, more frequent efforts to hit that wheelchair into a wall as long as they're not going to physically hurt themselves. More opportunities to get further into a dressing effort without getting the shirt on correctly. More efforts to try to communicate while they're word finding and searching without interruption or delay. And always, again, stopping the patient before they could physically harm themselves or before they're getting psychologically frustrated. And then finally, the level of anticipatory awareness, the final and highest level of awareness that a problem may occur. And then certainly the best way to get a patient to move into this is by first insisting that before you start any task, you verbally and together rehearse what previous efforts have been, and then you want to be able to get patients to do that without actually any cues from you, without a reminder of, hey, let's see, how did this go last time? Patients should be cueing themselves to rehearse how they did previously. And so that's one of the best ways to get into anticipatory awareness.